on breastfeedings. Okay, but first of all, I would like to congratulate all the newly mothers who are breastfeeding their babies, and I hope you all are enjoying your motherhood. Okay, but the only thing that is a challenging in this motherhood, that is feeding. Okay, so if the breastfeeding journey becomes easy, so definitely you will be enjoying the journey of motherhood, and the health issues are also very less, because what we have find that if the females who are not able to feed their baby, they gradually develop lots of anxiety and lots of depression also, because they are not able to feed. Okay, but they don't know that why they are not able to feed. Okay, because lots of cesareans are going on, but yes, if there is normal delivery also, still there is pain in sitting. So everything can be solved only if there is a good position. Okay, because it's not that if you are able not able to sit straight, so you're not able to feed. Okay, we have many positions to feed a baby. Okay, and that will make yourself comfortable. Okay, so as the breastfeeding week is also coming, so as the topic of this year is step up for breastfeeding, educate and support. So I'm very glad that nowadays people are so much concerned, and every people surrounding us are very much aware and helping. Okay, because these days what we have found that starting from the hospital till your office, every area is concerned about the feeding, and they all support the breastfeeding. So I equally मैं ये चाहती हूँ कि आप लोग भी और अवेयर हो और अपने आसपास ब्रेस्ट फीडिंग को इम्पोर्टेंस दें, एंड यू कैन सपोर्ट योर फ्रेंड, योर कलीग्स, your whatever the people are around you. Okay, now coming to the topic, that is breastfeeding. Yes, in breastfeeding we have lot many positions. That is the traditional position, that is a cradle position, that is most comfortable, and the females are very much comfortable in holding the baby, because maximum contact of the baby is there in the cradle position. Okay, second is cross cradle position. Okay, then comes football position, as there is a tendency of more twin pregnancies also these days. So the mother can easily feed their both the babies together in the this football position. Then there is a position, that is upright position. Upright position is also very easy and new and good also, because the parents who are feeling challenge in feeding their baby, having tongue tie, or there is an issue of what we say reflex, that is colic. Okay, many babies have a tendency to have colic more often. So upright position is very helpful, and it has been found very good in those infants. Okay, then yes, position is also very good for the Down syndrome. Down syndrome also there is a challenge in latching. Then after that position is the semi-fowler position, that is you can sit 45 degrees, and you can just have a good pillow positionings, and you can feed your baby. Okay, so these were the position, but these positions will only help you when you will position your baby's body comfortably. Okay, that means the essential position for all breastfeeding position is that whenever you are holding your baby should feel comfortable. That is, never carry your baby in a blanket or in a swaddling position to the breastfeeding. Okay, so so that your baby should feel comfortable. Okay, so there is a question that recently had a C-section delivery, and I find it uncomfortable to breastfeed in a sitting position. How can I manage this? Yes, This is what I was talking, that if there is a cesarean, so definitely the football position is more comfortable, because you're not able to sit straight for 2 to 3 days. So definitely you can just keep pillows on the side, two pillows, one and second one you can just turn slightly in the front, and you can just hold the baby. As I told you, the baby position should be straight in a straight line. Okay, the baby should not be in like this and you are twisting the neck. No. Okay, your ear, shoulder, hip, all should be in a straight line. Okay, and you can simply keep your baby in a side position. So in the front area of your cesarean area, that will be not in a panic. Okay, so this is the football position, and you can practice the feeding in this position. Second question is, my 4-month-old gets cranky when I hold him close for long while breastfeeding. What could be the issue? See, there could be many issues. Like, first of all, if like as you told, it's a 4 month, so definitely your baby knows very good latching, so there should be no any doubts that your baby doesn't know how to latch. So definitely just check for the position. Okay, that whether you are carrying your baby nicely or not. Second thing, you can just check, is there any tightness at the nipple, because sometimes what happen, if you keep long gap, so definitely your breast gets more heavy and the area gets more tightened. So sometimes the baby is not able to hold. Baby will latch, suckle 2 3 times, and the baby leaves it. Okay, due to difficulty. So this also you can check. So next is, I'm suffering from severe back pain post delivery. Which breastfeeding position can I try? See, definitely the reason for the back pain is if you are not feeding your baby in a correct position. Okay, so that is what I was talking about, the essential positions for all breastfeeding. That is, always keep pillow support. Okay, whether you're feeding on a chair, so just take care that you're carrying a pillow. Okay, you can keep a pillow at your backrest as well as in the front, so that you are not leaning forward. Okay, so definitely when you will get a good support at your back and front, so your position will be correct and your back pain will be relieved. And second thing, if there is more pain and straight sitting is very difficult, so definitely you can go to the lay back position, that is 45 degrees. Okay, and you can take the cushions and pillow supports to make yourself more comfortable, and you can just sit as in 45 degrees as well. And second, you can even feed your baby in football position also, and because keeping the baby at the side, it's more comfortable, we have seen. But the only challenge is that in a football position you are not able to hold the baby like maximum skin contact that is required, and that comes in cradle and cross cradle position. Okay, so next question is, when I breastfeed my 3 months old, I tend to experience a lot of pain around the neck and shoulder. How can I manage this? Yes, definitely. If because you have to feed your baby 8 to 10 times a day on an average. So definitely sitting for a longer duration and without any support, so that will lead to the neck pain. I will simply just tell you that after feeding your baby, you can just stretch your shoulders back like this 5 to 7 times. You can just rotate your shoulder clockwise, anti-clockwise 4 to 5 times, and you can just do chin tuck. So doing this after breastfeeding, it gives relief. to your neck and shoulder, and you will be not developing the neck and shoulder pain, because if it becomes chronic, that harms you more. Okay, so from the starting, you can just take care of this. And next question is, my baby experiences hiccups when I fed in a sideline position. Is this due to the position or some other reason? Okay, see, if it is happening again and again, so you can just change the position. Okay, and sometimes what happens, the baby takes hiccups very frequently. Okay, and this has been noticed very commonly. Okay, so but you are connecting it with the this sideline position, so definitely maybe baby has not done a good burp or what. So that is why we prefer feeding the baby in the sitting position. Okay, because in sideline, again I'll tell you that in the sideline position, the baby head will be in a line. So sometimes what happens, baby will keep the milk in the mouth only, so it can go to the lungs. Okay, so that may be also the reason. So you can just, if you're feeding your baby in a sideline, so just take care of the head. So head should be little bit up if you're feeding in that position, because we generally recommend in sitting position only, or in 45 degrees, that is low back position. Okay, so any other questions? Okay, so everyone just feed your baby exclusive breastfeeding for 6 months and continue till 2 years, and just keep feeding your baby and be happy. Don't take any stress, because stress also affects the feeding. Okay, thank you.